Hello, my name is Krishanna Turner, and I will be demonstrating how to measure blood pressure. Patients should refrain from smoking cigarettes or drinking caffeine for a minimum of 30 minutes prior to measurements. Patients should be seated quietly for 5 minutes in a chair with feet on the floor and back supported. Measurements should be taken on a bare arm on the left side. Next step is the blood pressure cuff. The appropriate cuff size must be used to ensure accurate measurement. To ensure the proper cuff size is used, there are markings on the inside of the cuff to show whether a small or large cuff is needed. The bladder within the cuff should encircle at least 80% of the upper arm. The cuff is then wrapped firmly around the upper arm and aligned with the brachial artery at heart level. The next is the calibrated manometer gauge, which is used to indicate how much pressure is inside the cuff in millimeters of mercury. Next is the inflation bulb that pumps air into the cuff. You will need to turn the valve on the pump all the way to the right before pumping air into the cuff. The instrument here is called the stethoscope. The earpieces are called prongs and should be positioned forward when placed inside the ears. The end piece is called a diaphragm, which is used to hear the Korotikoff sounds that I will explain later in the video. Also, make sure to check if the stethoscope is on by tapping on the diaphragm for loud noise. Next, I will place the diaphragm below the antecubital space over the brachial artery. Then you will quickly inflate the cuff pressure to 20 millimeters of mercury above the first Korotikoff sound, or around 200 millimeters of mercury if you do not know the patient's blood pressure. Slowly release pressure at a rate equal to 2 to 5 millimeters of mercury per second. The Korotikoff sounds that should be listened for are the sounds of the blood as it moves from an area of high pressure to that of lower pressure as the air is let out of the cuff. The first initial sound, similar to a tap or thumping noise, is indicated as the systolic blood pressure. The diastolic blood pressure is indicated by the point before the disappearance of the sound of the Korotikoff or the last muffled sound is heard. The blood pressure for my patient was 108/66, which falls under a normal BP blood pressure classification of less than 120 millimeters of mercury for systolic blood pressure and less than 80 millimeters of mercury for diastolic blood pressure. Here's a table of the classification and management of blood pressure for adults. Measurements should be taken a minimum of 1 minute apart, and the average should be taken from those two measurements. Before taking another measurement, you should allow the patient to rest for at least 5 minutes. Thank you for watching this video on blood pressure measurement.